and some of the disorders of hemostasis. We'll talk about these thromboembolic disorders, which result from undesirable clot formation. So basically, a thrombus is basically a blood clot that forms an unbroken blood vessel. And that can lead to an embolism if that clot breaks free and then travels to another vessel somewhere in the body and clogs that vessel. So we'll go through, I think, some of the more specific thromboembolic disorders. Bleeding disorders are going to be abnormalities that prevent normal clot formation. So you guys may be familiar with like hemophilia. It's a recessive disorder where individuals don't make proper clotting factors, and so they can't form blood clots very well on their own. So that requires they receive a lot of plasma transfusions to get enough of those clotting factors. And then disseminated intravascular coagulation, or DIC, it involves both types of disorders, so clotting and bleeding. In fact, DIC results from when you have so much bleeding that you run out of clotting factors. You know, think about this, like these clotting factors are a finite resources in your bloodstream or tissues. And if you have enough bleeding or basically trauma, you could potentially run out of these clotting factors. So you have a mixture of clotting and bleeding that can occur simultaneously. Now, a thrombus is where you have a clot that develops and persists in an unbroken blood vessel, and this can block circulation and lead to tissue death depending on where it occurs. So if think about if this thrombus blocks a vein, it's going to lead to a backup of blood sort of upstream of that vein, if that makes sense. Not downstream, because the venous blood is coming back towards the heart. So if that thrombus is blocking that venous vessel there, then blood's backing up upstream of the vein. And you can see things like edema that can result from a thrombus in a vein. Otherwise, if a thrombus occurs in an artery, all the tissues downstream of that artery won't get a sufficient amount of blood supply. So that can lead to ischemia, which can lead to necrosis. Now, a thrombus differs from an embolus because an embolus is where it's a freely floating clot somewhere in the blood. So a thrombus could turn into an embolus if it breaks free. And that could turn into an embolism. An embolism is basically where you have an obstruction of a vessel. So I'll give you guys an example. We'll come back to this next week. Because the right side of the heart pumps blood towards the lungs, and the right side of the heart receives blood from your systemic veins. Okay? So if you have a clot that forms in a vein of like your leg, it's going to come back up towards your heart, and then your heart's going to pump that out towards your lungs. Then that clot can get lodged in the vessels of your lungs, like the smaller one. So when we talk about emboluses that form in the peripheral veins, that can lead to blockage of your lungs. Okay, so we call it a pulmonary embolus. Otherwise, if you have one that starts maybe like in the left side of your heart, where that blood gets pumped towards the rest of the arteries of your body, that can lead to a blockage in one of your organ systems, like your brain, your liver, or pretty much any organ that receives arterial supply. Now, some of the risk factors for these, you guys, would be something like atherosclerosis, which is like a scarring of the arteries, inflammation of veins or blood vessels, or even slowing of blood flow. So we talk about this as stasis. So stasis is one of the factors that can influence clot formation. So you see individuals who are maybe immobile or do a lot of sitting and laying down for long periods of time. Well, that leads to such slow venous blood flow, it could put them at risk for blood clots. You know, like I suppose sitting in class from 8 to 4 can put you at risk for blood clots. Luckily, it doesn't normally happen, though. It's different anticoagulant drugs, you guys, like aspirin, heparin, warfarin, dabigatran. So all of these are going to basically prevent coagulation in some regard. So like aspirin affects this thromboxane A2 pathway. Heparin's a pretty potent anticoagulant. You know, we know it's made by our own body because it's made by those basophils, but it also is something that can be delivered in post-operative cardiac care. That way you can prevent blood clots from forming. Otherwise, like there's another one called warfarin or Coumadin. This one's used for people who are prone to like AFib. We talk about atrial fibrillation is where the atria of your heart just kind of quiver. That leads to turbulence in the heart that can lead to blood clots. In fact, this is one of the most common drugs to overdose on, warfarin or Coumadin. People who are on this can overdose more easily than some other drugs, and then they could have like uncontrollable bleeding, if that makes sense. Exactly. Yeah. I know. So and then dabigatran, you guys, inhibits thrombin. So all of these are anticoagulants. Now, if someone's had a heart attack, then they go on aspirin pretty much for the rest of their life. You take a daily aspirin after a heart attack. So what about bleeding disorders? Now, these aren't due to like excessive drug use, but one type of bleeding disorder, you guys, is thrombocytopenia. It's a deficiency in the number of circulating platelets. Now, this makes sense with respect to the fact that platelets are involved with the coagulation cascade. You need platelets to release clotting factors to get coagulation to occur. So if you have a deficiency in circulating platelets, then it's going to be more difficult to form blood clots. So this actually shows up as things like petechiae. Petechiae are basically pinpoint sort of bruising that can occur all over the skin. We'll see pictures of this later when we get to pathophysiology, but basically it's just like micro bruises that can occur all throughout your skin and other parts of the body, because just due to like minor amounts of damage, some blood vessels will rupture. But if you have a bleeding disorder, then that can turn into a hemorrhage, which is basically blood leaking out into your tissues, and it looks like these little pinpoint bruises all over. And that's sort of characteristic of thrombocytopenia. This thrombocytopenia can come about from suppression or destruction of red bone marrow, like from malignancy. So some forms of like leukemia can affect the number of circulating platelets. So someone can actually have low platelets from the leukemia itself, or radiation exposure, or even certain drugs. Like there's certain bone marrow suppressing drugs that can lead to thrombocytopenia. And it's a platelet count that's less than 50,000 per microliter. Remember on an earlier slide, it said 150,000 to 400,000 per mil. That didn't seem right to me. And I looked that up, and actually it's actually per microliter. And a microliter is 1/1,000,000th of a liter. So you're talking about how it's like the tiniest little drop can have 400,000 platelets in that tiny little drop. These things are so tiny they're almost even difficult to see. That's how big a microliter is. But if someone has a platelet count less than 50,000 platelets per microliter, then that's how we define thrombocytopenia. And it can be treated with transfusion. So basically, if you just do a blood transfusion, not even the whole blood, like you just have plasma and some of the buffy coat with platelets in it, that can help reverse that thrombocytopenia. Now, we know the liver is involved with synthesizing different factors that are involved with coagulation. And if someone has impaired liver function, this can lead to bleeding disorders as well. So if the liver can't normally produce these procoagulants, or if they can't store vitamin K, this can lead to bleeding disorders. And what's interesting to you guys is that the liver makes bile, and bile is necessary for the digestion of fats. Now, many of these fat-soluble vitamins are necessary for blood clotting. So if the liver is impaired, not only can't it store these fat-soluble vitamins, but it also has difficulty producing bile, which means you also have difficulty absorbing those fat-soluble vitamins from your food. So sort of a double whammy here. You can't digest and absorb these fat-soluble vitamins. Even if you do, you have more difficulty storing them because the liver can't store these as well. And these are necessary for the clotting cascade. Other bleeding disorders like hemophilia, you guys. There's different subcategories of hemophilia, and these are all just due to deficiencies of certain types of clotting factors. Now, all the hemophilias, though, are what we call autosomal recessive. And if they're recessive, what this means is you need to inherit a defective copy of this gene from both parents. So we'll come back to this later because we have a whole chapter on genetics in fourth quarter when I see you guys for pathophysiology. But what happens is that in order to get hemophilia, you need to inherit a defective copy of the gene from both parents, both your mother and father. And so by having those two defective copies, then you don't have any good copies of the gene, which means then that will lead to the expression of this disease. And you might wonder, well, why do you inherit two copies from each parent? Well, you get genetic information from each parent. So half of your chromosomes come from one parent, half come from the other. And on that, you're going to find a copy of a gene. So in order to get an autosomal recessive disorder like hemophilia, you have to have a parent that's either a carrier or it has hemophilia, and then another parent that's either a carrier or has hemophilia in order to get hemophilia. So it's more rare. In fact, a lot of hemophiliacs were unfortunately killed during the 80s when the HIV epidemic was spreading. They didn't have good ways to screen for HIV in whole blood back then. So people who were consistently getting a lot of blood transfusions were more likely to contract HIV. This is also pre-pharmaceutical revolution where we had good drugs against HIV, right? So, back then HIV was considered more of a death sentence. And unfortunately, because a lot of hemophiliacs were getting consistent blood transfusions due to their hemophilia to get more clotting factors, they were also more likely to get HIV that way. And so many of them died off You're less likely to see like older hemophiliacs nowadays because a lot of them unfortunately died in the 80s. You're more likely to see though like younger hemophiliacs nowadays because they would have been born like in the 90s and 2000s since that period of time, if that makes sense. Now we can screen for HIV in blood. Now, some of the symptoms of hemophilia, because it's a bleeding disorder, would be prolonged bleeding, obviously, but especially in the joint cavities. And you think about like your joints, even just walking around itself can damage blood vessels. And if you have a bleeding disorder, then that can lead to hemarthrosis or bleeding into your joints. And, that can lead to a lot of pain and inflammation. Now, like I said, it's treated with plasma transfusions, which also increases the risk of HIV and hepatitis. Now, disseminated intravascular coagulation was where we had widespread bleeding and clotting that occur simultaneously. How did this come about again, you guys? How could you have bleeding and clotting that occur at the same time? You got it. You can run out of clotting factors. They're not infinite in your body. Like, you can only make so much of these things. And so it's where you have widespread bleeding that leads to depleting all your clotting factors so that you can't actually form a proper blood clot. Pregnancy, this can occur during pregnancy. There's a lot of blood loss during pregnancy. Septicemia, or even incompatible blood transfusions because, and we'll come back to this later, you guys, but when antibodies stick onto an antigen, this stimulates clots to form. So let's say if someone had an incompatible transfusion, those antibodies sticking onto the foreign antigens also stimulate blood clots, right? And that's one of the reasons why we see clumping as well, because of the sort of clots forming. But this sort of widespread clotting can lead to the depletion of clotting factors. Now, earlier we talked about how all of our formed elements come from red bone marrow. And do you guys remember going back to bones? Like, what were some of the adult sources of red bone marrow? Long bones. But where in the long bones, though? In the heads. Very good. And typically the proximal epiphysis of long bones. So think of like the proximal epiphysis of your femur, your humerus. Do you guys know where else you find red bone marrow? In adults? In children, it's all over in the bones. But in adults, it's only in specific areas. Some of the short bones. Yeah, good. Coxal bones. So irregular bones like your coxal bones are full of red bone marrow. Your vertebrae, full of red bone marrow. Your sternum as well. And clavicles. Those are some of the sources of adult red bone marrow. But in children, it's more abundant. Think about it. They're growing more quickly. They're going to need more red bone marrow. But all this red bone marrow, you guys, is involved with hematopoiesis. And it has these pluripotent stem cells. Pluripotent means it's a stem cell that can turn into lots of different types of cells. And we call these the hemocytoblasts. The hemocytoblast is like the stem cell for red bone marrow. And it's basically the precursor stem cell to every single blood cell, right? Think of all your red blood cell, white blood cells, and platelets. Those are all derived from the hemocytoblast, okay? And these hemocytoblasts can differentiate into two main cell lines. We have a myeloid stem cell line and a lymphoid stem cell line. Now, the myeloid stem cell line gives rise to your erythrocytes, your platelets, and most of your leukocytes. The lymphoid stem cell line gives rise to all of the lymphocytes, and actually just the lymphocytes. Remember we talked about how with the leukocytes, we had neutrophils followed by lymphocytes, which were the second most abundant. Well, this lymphoid stem cell line gives rise to the subcategories of lymphocytes, like natural killer cells, B cells, and T cells. And you guys might be familiar with this already because most, when you talk about bone marrow cancers like leukemia and lymphoma, if it's a cancer of the lymphoid stem cell line, that's typically what we call a lymphoma. And if it's a cancer of the myeloid stem cell line, that's typically what we call a leukemia. So if you hear about someone getting leukemia, it's typically a cancer of the myeloid line, and a lymphoma is a cancer of this lymphoid line. So what this slide shows you guys are these stem cell lines here. So remember, it all derives from the hemocytoblast. We call this a pluripotent stem cell because it can give rise to any type of blood cell in your body. Now, what happens is that these cells are stimulated to divide, whether in the myeloid or the lymphoid line, through certain growth factors. And these growth factors are released by cells in your body. So let's say if you have an infection, some of your immune cells can release certain growth factors that can stimulate the production of new immune cells. So the lymphoid stem cell line only gives rise to the lymphocytes. And there's 3 types of lymphocytes. We got B cells, T cells, and natural killer cells. Okay? Now, if it's a cancer of the lymphoid stem cell line, we typically call that a lymphoma. And the reason why I say typically, you guys, is that it also depends on where these cells are located. Like, they have to be in your lymph or lymph nodes or lymphoid tissue on top of being a cancer of the lymphoid stem cell line to be called a lymphoma. So not only does it depend on what cell type it is, but also the location of those cells in your body. Now that differs from the leukemias, because leukemias are derived from the myeloid stem cell line, and they typically are found in blood and bone marrow. Okay? Now, the myeloid stem cell line gives rise to a lot of other different types of cells. Okay? So you can see that the myeloid stem cell line gives rise to the red blood cells, gives rise to platelets, and the rest of your leukocytes. So the neutrophils, the monocytes, the eosinophils, and the basophils, all of those come from the myeloid stem cell line. And there's different subcategories of leukemias and lymphomas that we'll learn about in pathophysiology. And they're based on the type of cell you find in there. So we have like non-Hodgkin's versus Hodgkin's lymphoma, and it depends on the types of cells, which also depend on the stem cell line. How do people get cancer? You guys know? They're when cells like sort of abnormally divide or too rapidly, and it could be due to mutation, whether it's inherited or random mutation. Cancers can also be caused by viruses. So some viruses cause cancer. Like there's a human T cell type of lymphoma that's caused by a herpes virus, and when this herpes virus infects the cell, it induces mutations in the genes of that cell that actually make it more likely to become cancers. So it's kind of interesting. So what that means then is that some forms of cancer are infectious if they're caused by viruses, and viruses are infectious. So it's kind of weird. I know. So what does the lymphoid stem cell line give rise to? Lymphocytes. So B, T, natural killer cells. And then how about the myeloid stem cell line? Everything else. Everything else in the blood, right? Not everything in your body, but everything else in the blood. So that's the erythrocytes or red blood cells, the thrombocytes or platelets, as well as the remaining leukocytes, right? So your eosinophils, basophils, neutrophils, and monocytes. Don't memorize these pathways, you guys. Like, don't memorize that it's the pro-erythroblast that gives rise to the early erythroblasts. That's kind of silly. What I want you guys to know just are the terminal cells that come from each stem cell line, right? So what if someone had an excessive amount of B cells in their lymph? What stem cell do you guys think would be affected? Lymphoid, exactly. And B cells are the type of lymphocyte, right? How about if someone had an excessive amount of red blood cells? Myeloid, good. And there's actually a cancer of red blood cells called polycythemia vera, where you have excessive amount of red blood cells due to that particular type of cell. So it's kind of interesting. Now, kind of getting away from that idea of cancer, you guys, we're going to talk about normal regulation of erythropoiesis, or production of red blood cells. So if you have too few red blood cells, this leads to hypoxia, which isn't good. That means low oxygen levels in tissue. Otherwise, if you have too many red blood cells, it makes your blood more viscous. Viscosity is a resistance to flow. So if you have a lot of red blood cells in your blood, in fact, what's the percent of your blood volume that are erythrocytes? 45%. Yeah, around 45%. What if you got up to like 60%, 70%? Yeah, your blood, you're right, it becomes more sludgy, more viscous and resistant to flow. In fact, that actually puts additional stress on your heart to pump the blood, because now your heart's basically pumping sludgy, viscous, syrupy type of blood. And so that's why having too many red blood cells isn't a good thing, right? So there's a sort of a delicate balance between these two. Like having enough to where your tissues don't become hypoxic, but not having too many red blood cells to the point where your blood is sludgy. I'll tell you what, you guys, because we all live at altitude, Denver's Mile High City, we actually have more red blood cells in our hematocrit than people at sea level, because it takes more red blood cells for us to transport enough gases to supply our body with enough of its tissue demand. So what this means, though, is that if we go to sea level, we have a lot of red blood cells, like more than we need at sea level. And so this is one of the reasons why the Olympic Training Center is in Colorado, because if Olympic athletes train here, they can get their red blood cell count higher because the oxygen levels are lower here. And then when they go compete at sea level, they rocket because now they have more red blood cells than their body would normally make at sea level. So it's kind of interesting.
Players have a harder time when they come here.
Probably, yeah, because they're sort of like slightly anemic. If you practice at sea level and then you come to Colorado to compete, you don't have enough red blood cells to live in this atmosphere, at least not efficiently. So then, yeah, it's sort of like anemia just by
They're all
the virtue of traveling. I saw that last night. So there's a balance between production and destruction. What do you guys think would happen if you had more red blood cell destruction than production? Hypoxia, which could be due to anemia. You could just have like a very low red blood cell count, right? Like if your red blood cells were being destroyed faster than they were being created, then eventually you're going to get sort of dwindling numbers of red blood cells. What if you're creating red blood cells faster than they were destroyed? High blood viscosity, right? You have too many red blood cells, which make your blood more viscous. Now, in 2 weeks, we'll talk about blood pressure regulation. And it turns out blood viscosity is one of the things that determines blood pressure. And those things are proportional. If your blood becomes more viscous, it's more resistant to flow, and therefore you have a higher blood pressure. It's harder to pump. Yeah, exactly. So this is also controlled, you guys, by adequate supplies of iron, amino acids, and certain B vitamins. Certain B vitamins are necessary for cell division. So you got to have enough of this in your diet in order to avoid things like anemia. So we know that erythropoiesis is controlled by a hormone. We talked about this back in the endocrine system, where the kidneys release this hormone EPO, or erythropoietin. If y'all remember, the kidneys have oxygen sensors, or O2 sensors. So when O2 levels get too low, the kidneys can release erythropoietin to stimulate red blood cell growth in your red bone marrow. So there's this interesting interplay between a communication of your kidneys and red bone marrow. Now, there's always a small amount of erythropoietin being released by our kidneys, sort of at a basal level to maintain like just normal levels of red blood cells. But if you are particularly hypoxic, like let's say if you guys just decided to move to Leadville, right, which is the highest city in North America, moving to Leadville would actually kind of make it like it's hypoxic in your body because you don't have enough red blood cells to live there yet, right? At least not like efficiently. So that tissue hypoxia your body would experience by living in Leadville would lead to your kidneys producing the hormone erythropoietin to stimulate more red blood cell growth. So it's kind of interesting. In fact, I've got a colleague who like has a cabin up in Evergreen, and what he was telling me, and it's just totally like anecdotal evidence, but it's just weird. He was saying that whenever he goes and spends a lot of time up there, because Evergreen's at 8,000 feet, or his cabin's at 8,000 feet, he starts craving like red meat, and particularly squirrels. Like living up, like he's up in the woods, right? And he sees lots of squirrels running around. All of a sudden he starts craving squirrels. Like, I'm gonna eat a squirrel, right? No, and
Have you ever done it?
I don't know. I didn't ask him. I don't know. Some things I just don't want to know. Like, I don't know. But what his hypothesis was that because he's up at 8,000 feet, maybe he's kind of hypoxic, right? And so that he needs more iron in squirrel meat to maybe get more red blood cells to live up there, right? So it's interesting. Maybe. Yeah, that's his hypothesis. It doesn't mean it's true, but it's his guess, so it's interesting.
Maybe he's just like being in the woods makes him feel all like lumberjack.
Yeah, right.
Wants to eat.
Some squirrel pies.
There's probably deer.
So what we see here, you guys, is basically a balance then of normal blood oxygen levels. So if blood O2 levels get too low, and this could be either due to low O2 levels in the atmosphere, or if you just don't have enough red blood cells in your bloodstream, your kidneys have O2 sensors, and they'll sense when this is hypoxic. Therefore, they release the hormone erythropoietin, EPO, that travels on over to red bone marrow, which actually stimulates red bone marrow to grow new red blood cells. So what stem cell line do red blood cells come from? Myeloid. Good. So we can understand then that this erythropoietin hormone would stimulate aspects of the myeloid stem cell line, right? That would actually increase cell production there. That way you get enough red blood cells to eventually bring you back towards homeostasis. Now, some other dietary requirements, you guys, for erythropoiesis, like we were talking about, iron is a big one. It's available in diet. We have a lot of iron supplementation in our food. I don't know if you guys knew this, but a lot of cereals have added iron in them, like fortified iron. when you talk about like fortified cereals, they typically add iron there. In fact, there's enough iron in our cereal that our cereal is magnetic. Like if you put a magnet next to your cereal, you can actually cause the cereal to move with your magnet. That's how much iron is in there. I know. So it's interesting. If you guys have a magnet and you have fortified cereal, like I think Special K has that stuff. Probably Cheerios too. Yeah, try it out, you guys. I'd be interested to know your results. I've seen it on YouTube, but I don't own cereal. I don't eat cereal, but I'd be interested to know if that works for you. So because I don't actually eat I can't eat breakfast. I don't get hungry in the morning. Like I just ate lunch. That was my first meal of the day, which is weird. I know. I just don't get hungry in the morning. I have to force myself to eat, which then makes me feel sick. So I don't know. I know it's not the healthiest thing to do. Most of the iron in your body, you guys, is actually bound to hemoglobin. The rest is you find in your liver and spleen and bone marrow. In fact, later on, we'll learn about during the immune response, one of the functions of fever during an immune response is to cause your liver and spleen to uptake more iron, right? It takes iron out of your blood and stores it in those organs. Why would it make sense if you have a fever to store more iron in those organs instead of having free iron floating around your blood? You got it. That's a nutrient for bacteria. So part of the fever response is to take iron out of your blood and store it in the liver and spleen. That way there's less of that nutrient available for the bacteria to feed on, and you're more likely to clear out that infection, which is actually pretty awesome. That's one of the effects of fever. One thing that's important to note, you guys, is that we don't find free iron in your body under normal circumstances. Like you don't just have iron atoms just freely floating around in your bloodstream or tissues, because free iron is toxic. Like I mentioned earlier, iron has the capability of producing free radicals that can damage chemical bonds throughout your body. So you don't want like a tremendous amount of iron floating around your bloodstream. Otherwise, it's stored in cells as ferritin or hemosiderin, and it's transported in blood by this protein called transferrin. So it's one of the regulatory proteins we talked about. Vitamin B12, you guys, and folic acid are also necessary for DNA synthesis. And there's different forms of anemia that come from vitamin B12 and folic acid deficiencies. You know, vitamin B12 is one of those things that you find in high concentrations in meat. So people on vegetarian diets have to be careful about getting enough vitamin B12 in their diet. Folic acid you find in leafy greens, folate. And if you're not eating enough leafy greens, you could be deficient in folic acid. So you got to make sure you're getting enough of these nutrients in order to avoid anemia, because these are necessary for DNA synthesis, which is necessary for cell division, which you need to make new red blood cells. So if you lack vitamin B12 or folic acid, you can become anemic as a result. So it's interesting. Now, women are especially prone to anemia. You guys guess why? Menstruation. Yeah. It's suspected that 20% of menstruating women are currently anemic. Like if you're currently menstruating, 1 out of 5 of those menstruating women are probably anemic due to that blood loss. I know it's not like a tremendous amount of blood, you guys, but it's enough to induce a little bit of anemia, if that makes sense. So if you're talking about like vegetarians or vegans that are also female, they got to be careful about anemia because of the consistent blood loss. So it's interesting. Now there's different causes of anemia. It can come from blood loss, like menstruation, or trauma. Otherwise, it can come from low red blood cell production or high red blood cell destruction. So hemorrhagic anemia just comes from blood loss that's rapid, like a stab wound. It's treated by blood replacement. And we talked about proper transfusions earlier, like who can receive blood from certain blood types. Otherwise, chronic hemorrhagic anemia is a slow but persistent type of blood loss. And you might find this with like ulcerative colitis. Like if someone has gastrointestinal ulcers and they don't really know that they're there, they can have like a little bit of blood loss in their stool, but not even really be aware that there's blood in their stool. Because not all the time, blood in the stool doesn't always look red, you know, because it can be digested by bacteria in your gut. If you're finding blood in your stool, it's probably a ruptured epithelium, like closer to the anus. Otherwise, if you have blood in the stool and it doesn't look like blood, it's kind of more of a black tarry type substance, that's probably due to blood loss farther up in the intestine, where the bacteria have time to break it down. Yeah, it kind of smells. It smells like metal. Like people can make that. You can see this with like ulcers or hemorrhoids too, you guys. Now, you know, just to reverse this, you just got to treat the primary problem, wherever that source of blood loss is. Now, in terms of low red blood cell production, This is going to result from either deficiencies in a nutrient or damage to red bone marrow. So iron deficiency anemia basically would lead to low red blood cell production because then you don't have enough iron to make enough hemoglobin to make new red blood cells. And so iron supplements are needed to treat this. In fact, a pretty large portion of the world, you guys, is iron deficient. Unless you're eating a lot of red meat or somehow getting dirt in your diet, it's more difficult to find like a significant amount of iron. Oh, leafy greens too. Leafy greens have a lot of iron, but that's also seasonal, right? And if you live in the part of the world where you can't eat leafy greens year round, then it's hard to find iron in off season, right?
So just go eat some dirt.
Yeah, and they do. So you go to the Dominican Republic, and they're making dirt cookies because these poor kids don't get enough meat in their diet or fresh vegetables, that they eat mud cakes to get enough iron to avoid anemia. Now, what this looks like then, you guys, are microcytic hypochromic cells. So microcytic means small cells. Hypochromic means they don't have as much color to them. The reason why these red blood cells are red is because of the iron. But if they have less iron inside the cell, then they don't look as red. Pernicious anemia is an autoimmune disease, you guys, where you can have destruction of the stomach lining. And what's interesting is that, and we'll learn about this later, is that one of the cell types in your stomach makes something called intrinsic factor. And you need intrinsic factor for vitamin B12 absorption. So if your immune system is attacking your stomach lining and you can't make intrinsic factor, that means that even if you had enough vitamin B12 in your diet, you wouldn't be absorbing that vitamin B12 as efficiently, and that can lead to anemia. Okay. Something else that can cause a pernicious anemia, guys, is anything that can irritate the stomach lining. So think of some foods that might irritate your stomach lining, or drinks. People like chronic alcoholics can suffer from pernicious anemia because alcohol is an irritant. It irritates the stomach lining. Then they can't make as much intrinsic factor, which means they have difficulty absorbing vitamin B12, and that can lead to anemia. So it's kind of interesting. Or what if you have like Crohn's disease or some other sort of disorder of inflammation of the stomach lining? So this can be treated with vitamin B12 injections or nasal gel. You can find this commonly in like vegetarians too, because of low vitamin B12 in their diet. Now, with renal anemia, this is going to be it's a form of anemia due to kidney failure, right? So how do the kidneys play a role in erythropoiesis?
They release EPO.
Right, they release EPO, and they release EPO when blood oxygen levels are low. Very good. Now, if the kidneys are failing, which means the cells are dying, and they can't release erythropoietin, then you're not stimulating red bone marrow to make new red blood cells, so that a renal anemia can come about from kidney disease. So how weird is that? You can get anemia from a kidney disorder or disease. It's interesting. Under really extreme conditions, though, your liver can make a little bit of EPO, but it would take really extreme conditions to get to that point. Otherwise, it's just treated with synthetic EPO. In fact, this is one of those hormones that athletes use to dope, like blood doping. People can inject themselves with erythropoietin, which can stimulate red blood cell growth. And in the case of like Lance Armstrong, what he was doing was injecting EPO into his body, then storing those excess red blood cells for later use. And then right before a big event, injecting those red blood cells back into his body to bring his hematocrit way up. And yes, you might make the argument, yeah, his blood would be more viscous. But if you have a strong heart, it's not going to make that much of a difference anyways, But if you have more red blood cells, you can perform better. So it's interesting. And just to defend that guy, so my dad lives near Aspen. He lives in Glenwood Springs. And there's a lot of like competitive athletes that live there. He knows a professional cyclist in Aspen who said that everybody does it. It's not a question of who does it, it's everybody does it. And if you don't do it, you're not a professional cyclist. I'm talking about cycling, right? But it's like everybody does it, and if you didn't, you couldn't be good enough to even compete. And it's just he just got picked on. Well, I mean, think about it. He won like 7 times in a row or something. So I think he kind of stood out like a sore thumb. Yeah, he's too good. Aplastic anemia, guys, is due to destruction of red bone marrow by drugs, chemicals, radiation, or viruses. It can be due to unknown causes as well. But with aplastic anemia, all cell lines are affected, not just the myeloid stem cell line, but also the lymphoid stem cell line. So not only will you see a destruction of red blood cells, but also other blood elements, so platelets and leukocytes and that kind of stuff. This can be treated short-term with transfusions. Otherwise, in the long term, you would need to replace that damaged red bone marrow, right? And this can either be from your own body or from someone else's body, right? And so you can be like a bone marrow donor. And so they can basically take stem cells from your body and transplant them into somebody else to make new blood cells. The hemolytic anemias, you guys, come from premature red blood cell lysis. And so it can be caused by hemoglobin abnormalities, incompatible transfusions, or even infection. And hemolytic just means blood lysis, or basically breaking apart of these cells. So the first type of hemolytic anemia we'll talk about, you guys, are the genetic bases like hereditary spherocytosis or even sickle cell anemia. But what happens with these genetic hemolytic anemias is that you have a mutation, bless you, in the protein of hemoglobin that makes hemoglobin change its shape in a way that allows for red blood cells to actually be weaker, not stronger. And so if the red blood cells are more weakened, they're more likely to break open, lyse open, and have a shorter lifespan. Okay. So the one we'll talk about here, you guys, is the thalassemia. Thalassemias are typically common to individuals of Mediterranean descent. Think Southern Europe, Northern Africa, like Roman Empire, all around the Mediterranean. Those individuals are more likely to suffer from thalassemia, which is a point mutation in hemoglobin that causes red blood cells to be thin, delicate, and therefore less likely to last for 4 months. And this can lead to mild to severe anemia. You guys may have heard of sickle cell anemia before. Sickle cell anemia is common to individuals of sub-Saharan West Africa because in that part of the world, there's a lot of malaria. Malaria is a parasite that's transmitted by mosquitoes. Now, what's interesting is that sickle cell anemia it's a genetic mutation in the gene that encodes for hemoglobin. It's actually a point mutation. Now, what this causes, though, are the red blood cells to take on a crescent shape or sickle shape. You guys know, like the communist symbol. It's the sickle and hammer. And the sickle is that device you'd use to cut hay and stuff. And there's a hammer. I don't know what that represents. Maybe to crush capitalism, right? But the sickle is that sort of sharp, sort of crescent moon-shaped structure. Red blood cells take on that shape with sickle cell anemia. In fact, when they take on that shape, not only do the red blood cells become more weak, but they're also more fragile and more likely to stick to each other. So with sickle cell anemia, it makes you more prone to forming blood clots, and it leads to anemia because these red blood cells don't live as long. So it takes more effort to make new red blood cells. Now, it's typically pretty painful too because these can block blood vessels, and that can lead to inflammation and pain. It seems to be related to malaria. So here's the interesting association, you guys. Malaria is a plasmodium parasite, which basically means it's eukaryotic, and it likes, once it's in your bloodstream, it'll wiggle inside your blood vessels and feed on your hemoglobin. And it makes sense. Hemoglobin's protein rich, it's got a lot of iron, right? A lot of nutrients there. So malaria, Plasmodium falciparum, loves to feed on hemoglobin, which means it gets inside your red blood cells and eats that up, right? If you have sickle cell anemia and your red blood cells have the crescent shaped, it's harder for malaria to get inside your red blood cells to feed on that hemoglobin. So what does this mean if you have sickle cell anemia and you're infected with malaria? You got it. You're more likely to survive that infection. So what does this mean if you if you survive the infection because you have sickle cell anemia, someone else didn't survive the infection because they didn't have sickle cell anemia, then you're more likely to spread on your genes, right, to next generations. So what happens is multiply this by hundreds of thousands of years. Now you have entire segments of the gene pool where a lot of people have sickle cell anemia because it's actually protective against this fatal disease. And so you're looking at human evolution in action.
And so that's why it's pretty prevalent in the African American population because malaria was a bigger problem.
You got it. Now there used to be malaria in the southern United States. It was eradicated with like massive mosquito kills back like in the late 19th century. Yeah, with DEET, exactly. Now it seems to be coming back though, unfortunately. There's been some cases in Florida already. But what's also interesting, you guys, is that just this last year, there was a group of 3 people. One was a lady that studies traditional Chinese medicine, and then 2 other people out of somewhere in Europe. They just won the Nobel Prize in chemistry because they discovered a new compound that's really effective at targeting malaria. And this is naturally found in plants and that kind of stuff. And it's been used in Chinese medicine for thousands of years, but they finally were able to isolate the chemical, which is good. Now we can standardize the dose put it in pill form and treat malaria. So there's some promising future there. This is pretty cool. So this is what it's showing you guys. If sickle cell anemia, it's basically a point mutation. So instead of having this particular amino acid here, you have a different amino acid in the protein chain, and it's just a difference of one amino acid that makes the entire hemoglobin protein different enough to give red blood cells this crescent shape. And you might wonder, well, how does this protect against malaria? Well, by having a crescent shape, it actually makes it more difficult for the plasmodium to wiggle inside the cell. Because think about it, there's like more tension on the plasma membrane. Like it's not loose like the biconcave disc. It's more like kind of tensed up. It's tight, so it's more difficult for the malaria to get inside that cell. So it's actually really interesting. So that's sickle cell anemia. We'll talk about more on the pathogenesis of this and pathophysiology.